Witam serdecznie, Michał Urgacz z tej strony z gabinetu Uwolnienia od Bólu. Jak dobrze wiecie, na co dzień wykorzystuję badania termograficzne do tego, aby poprawnie zdiagnozować moich pacjentów, żeby jak najsprawniej uwolnić ich od dolegliwości bólowych. I teraz istnieje potężna możliwość na to, żebyście i wy zyskali taką wiedzę, tym bardziej, że będzie to wiedza od mojego nauczyciela, którym jest profesor Brioschi, wybitny specjalista, jeżeli chodzi o świat termografii medycznej, ktoś, kto poświęcił całą swoją karierę medyczną na to, ażeby właśnie znaleźć maksymalne korelacje pomiędzy występującymi chorobami a obrazami termicznymi, które można zarejestrować za pomocą kamer termowizyjnych. Przyjeżdża tutaj poprowadzić szkolenie, już 11-12 lipca jesteśmy organizatorami tego szkolenia w Warszawie. Potężna dawka informacji dotycząca tego, jak obrazować przede wszystkim radikulopatię, jak radzić sobie z dolegliwościami mięśniowo-powięziowymi, jak wykonywać zabiegi w nadzorze termografii medycznej, ale również o tym, jak leczyć i jak diagnozować, jeżeli chodzi o kończyny dolne, zaburzenia mikrokrążenia, powstawanie owrzodzeń oraz dolegliwości związane z polineuropatią dystalną. Będzie również duża dawka informacji dotycząca chorób metabolicznych, jak i obrazowania samych piersi za pomocą badania termograficznego. Słuchajcie, chcę, abyście poznali profesora nieco bliżej, dlatego też zorganizowałem krótki wywiad przez Skype. Zobaczcie sami. Okay. Hello, Professor Marcos.
Hello, Michelle. How are you?
I'm fine, thanks. What about you?
Very good.
Okay. So, Marcos, we met each other in EPE a few years ago. You teach me the thermography, medical thermography. I'm practicing that a lot. It's a brilliant diagnostic tool, especially when connecting with other let's say ways, for example, to pain reliefs like acupuncture. So I'm mainly using that for the pain diagnosis, and it's working really good. Now you're coming to Poland. We are organizing 2 days course in Warsaw. I would like to ask you about what kind of knowledge you will bring in.
Okay. First, I'd like to present me. I'm on work with thermography since 1999, so it's almost 20 years. And when I began, it was very interesting because I was very focused on surgery. And in the beginning, we become very marvelous with the technology because you see the colors, see the computers, and after you start to understand that it's necessary to study more about thermology, because thermology is a concept more big than only to do thermography. And when you understand how the human beings work with thermal biology, you understand better the images. So it's very important to understand how the images are related with the diseases. So when I started, I didn't start doing the reporters, things like these things. I started doing research with animals, rats, and I did my master degree and postdoctoral degree, and actually with more experience, I started to have a group of medical students that are doing the thermology specialists. So it's the first place in the world to have 1 year training course. Mm-hmm. It's 1.5 years training every month. So we discuss about pain, about diabetes, about thyroid, ulcerations, circulatory problems. So in each month we talk about this. So when I started, it was very interesting because nobody knows about thermography. I was one of the first one. So, but when I started, I didn't have idea in what we will reach today. So today here where I live, most of the hospitals are doing thermography as adjunct exams with ultrasound, tomography, magnetic resonance. So for us, it's very normal, very regular to do thermography to study pain. And next week, we have a national congress of pain. And so the most most of doctors will present about thermography. And I'm very happy with this because 20 years ago it was a subject that nobody know about thermography. What's thermography in pain? And actually, I see my colleagues talking about neuropathic pain, radicular pain. In all their presentations, they present infrared images because they understand that it's very important to their clinic to show these images.
Yes, it is a method that can see the pain really, because you're showing the vasoconstriction, vasodilatation as well. So it's a brilliant tool. I really like it to diagnose the pain.
I like to compare with ultrasound because most of doctors say I have ultrasound. It's not necessarily infrared, but with infrared, it's different from ultrasound because in ultrasound you can see inflammatory problem on the shoulders, on the knee, but you don't see the radicular problem,
yes,
the neuropathic problem. So thermography is much important because you can see the somatosympathetic response on the limbs. So you can see also the inflammation on the shoulder, but especially the radicular that is very, very common to this patient. And if you do the wrong diagnosis, if you just think it's supraspinatus tendinopathy, for example, and you treat this, you not have success on this treatment because you have a radicular. And it's very important to understand that most of radicular problems are not painful, especially on more young person, and most of the time we forget this. And when you practice acupuncture, it's very interesting because most of the time you're treating the dermatoma that's responsible for that radicular problem. Most of the time, I know that most of acupuncturists don't have thermography, so they do this, but they don't have conscious that what they really doing. Because most of doctors don't know if they really put the needle in the right place.
Yes.
So they only put the needle and don't see what happened.
Yes.
And I show to our students that when you must do a thermal guide acupuncture because you see what has happened with your patient and you can be much more effective in your treatment, independent of which technique you use, if proximal, hashi point, or paravertebral, no mind, but it's very important to see what happened when you put the needle. And most of the time you have a reflex response that are very distant. I have a case that we put, for example, the needle on the face, B2, for example, blader 2, and you have a response on blader 54 very distant. So it's amazing to understand this. And it's interesting that there are patients that have this reaction, the others that don't have the same reaction. So it means that the treatment must be personalized. It must be individualized. So because the person have a different response. And how to see this? How to get this response? In the practice, in medical practice, most of the doctors, acupuncturists don't see this. So they wait and hope that they are in the right place, in the right treatment. But when you see this during your treatment, you have secured that it's right, and your patient can see too at the same time. I think that it's very important the patient to see the images during the treatment also, because this is humanization. Thermography is a high technology, but at the same time it brings humanization to the treatment, because you can, when you share the images with the patients in the real time.
Yeah, that's true. Sometimes patients after needling, they feeling the heat, the temperature is going up, but sometimes they don't, and so this is the best solution to show them that something happened distally, distal, let's say, reactions. Yeah, that's true. I think it's the best solution to compare distal needling with, for example, radiculopathy or some specific diagnosis and illness. So yes, that's true. What else? What about the diabetic foot?
Diabetic is a very common disease, so you must be attention with this because the treatment, if they have a pain or a diabetic foot that is a neuropathy, their response is different for that one that don't have diabetes. So who do the treatment of pain or acupuncture to see if the patient has neuropathy, because the neuropathic foot is something that the patient will feel in a late phase, not very early.
Yes.
And with thermography you can see very early, most of times in the same when the patients have the glycemia, the glycemia levels very not specific for diabetes, but you can see the neuropathic pain, neuropathic problems on the foot, because the foot have a big nerve and it's the most sensitive nerve to be lesioned in the early phase. So it's important to do this. And other thing that I must to explain is that the better acupuncture is not that one that use much of a lot of needling, and not the big ones, but that one that can resolve the problem or the pain with the less number of needling.
Yes.
So this is very important because it look like for example you have many guns. you use all at the same time. It's not, most of the time if you do this, you be needling in the wrong places, or you be causing trigger problems in normal regions. So it's important to see what has happened to be a precise needling also in diabetic patients, because they have not only neuropathic problems on the foot, but most of times on the trunk or in the hands.
Yes.
So you must understand this, because they will not say about this, but you see with thermography.
Yeah, that's true. Sometimes they don't feel even this change because it's coming, let's say, much time before. Yeah, you can catch the illness earlier, much earlier than it happens. So it's a brilliant tool it's a brilliant diagnostic tool in the, let's say, diabetic foot as well, and diabetes as well. Even if in our practice we catch, let's say, that diabetes by thermography before the lab test, before the blood test.
And the other thing important is to understand the metabolism of the patients. Most of patients with diabetes have a low metabolism. So you can use thermography to understand the cerebral thermodynamics and understand the metabolism of the brain. And with acupuncture, you also can give more response or stimulus to the brain to have a better metabolism. So we do this measuring the temperature between the eyes. That's the BTT, that's the brain tunnel temperature. That's a reference of brain temperature, and you can understand the metabolism of your patients. So you can do in the monitoring in the first section, second, third, and all, to understand if it's become higher or lower. So if it become lower, it's not a good sign, because diabetes is progressing, and if it is a higher temperature, it's become better by each sessions.
Okay, so you're using BTT in metabolism diagnosing, you mean?
Yes, it's one parameter, one of the parameters.
Okay, It's a lot of knowledge, so it will be really busy 2 days in Warsaw, I think. Wish to be there. For sure, I will be there. And what else? What other knowledge you will share in Warsaw?
I like to share my monitor here. It's very important to do the thermo-guided computer to understand if you have trigger points or if you have radicular problems associated with these points, and also to understand which one is the main point.
Okay.
Because if you find the main point, you can block the other ones. And about BTT, I like to show this. This is the infrared image of the face, and here you have the high temperature on the in the inner canthus of the eye. Okay. And we are with a new software to do 3D images. It's not really 3D. I explained this. It's a method that gives 15 times more resolution than any camera. So they bring your camera and give you 15 times more resolution, and you can travel between the image and understand the parameters of this. So it's a different way to analyze the images, and it's giving us a big difference to understand what's happened with the patients. For example, here we have a simple camera with low resolution, but you can bring this in another perspective and have by artificial intelligence to find the main trigger points on this patient, especially in patients that don't have pain yet. So you can calculate the risk of lumbar pain, for example, and make we are doing acupuncture, preventive acupuncture on employees in big companies that are doing this, because we are using a non-invasive exam like infrared and bring this technology in a very easy way to use in the practice. So the camera is not the main, it's not so important as much your acknowledgement and the software that give you the way to find this, to give you the precision of the place that you must work. So so with this technology that we developed, it's possible to find like hills, where's the Everest or in the lumbar. So it look like the discopathie, but it's the temperature of the lumbar. So we are using this technology, and we'd like to present during my coming to Poland. And also this is being integrated with smartphones and bring this information for the patients to monitoring their results in real time in each session. So we have much technology actually to help our patients, and I want to show to you what is the news about this. If artificial intelligence, telemedicine, new softwares, and many way that we work with the patients, electronic reporters, the information on the smartphones, so and also the big data of patients. I believe that in the near future, we have a big data of the infrared image problems, and this will be accessed by everyone that works with infrared image, and our diagnosis will be much more precise and not so subjective or based on just looking the image and trying to understand. For example, the breast, for breast cancer, we have good papers and papers that don't give good results with breast cancer. And if you compare why we have bad reports and good papers, it's because the ones that have good results, they use it, most of them artificial intelligence algorithms to elevate the sensitivity and specificity of exams. And most of the old papers that have medium or low sensitivity or specificities are based on subjective evaluation. So in my practice, it's really important that we start to use this artificial intelligence to help us to have thermography in hospitals and medical centers, because it's not possible only just to see the image and doing diagnosis all the times. You must understand how to do this, but you must understand that the next step will be to have this integrated with artificial intelligence in your practice, independent if you do acupuncture or internal medicine or dermatology, anything. So we have a good, promising future for thermography in this way.
Yeah, it's very nice. So, see you soon in Poland.
Okay, it'll be very nice, and I'm very anxious to be with your group there.
Me too. See you soon. Thank you very much. Have a nice day.
Bye.
Bye bye.
Good day. Bye.
Jak widzicie, potężna dawka informacji, którą można zyskać już podczas właśnie szkolenia lipcowego. Jeżeli jesteście zainteresowani, serdecznie zapraszam do linku poniżej. Tam znajdziecie wszelkiego rodzaju informacje logistyczne, cenowe, które będą dotyczyły właśnie tego szkolenia. Tam również znajdziecie pełen zakres, który zostanie poruszony właśnie podczas tego dwudniowego intensywnego szkolenia. Serdecznie zapraszam i do zobaczenia.